Okay, so we've got a question here from Bree. As a social worker, you must come across some difficult situations. How do you take care of your own mental health during work? Good question. Who's going to go first?
I mean, I think it's back to the whole business of the team. So if you feel safe and connected to your colleagues, and you have a manager who supports you, who understands when you might need a bit of time out, I think you can survive very well, actually. There's lots and lots of work been done and been written about supervision. That's really, really critical. So yeah, I mean, that's at the heart of it for me, mental health. I mean, yes, you can seek your own individual support for mental health. You can look at your work patterns, but I would still say that fundamental to social workers' well-being are their colleagues and the ethos of the team.
Yeah, I mean, I suppose it comes back a little bit to what I was saying about vulnerability and being okay about saying when you're not. One of the things that I did struggle with when I first went into child protection is there was a bit of a culture for a while, and I can see that there's been a shift, but about, well, you just have to get on with it and you need to toughen up and you need to, and I did really struggle that with times, and I would go home and go, oh, I don't know whether I'm tough enough to do this, and some of the challenges really did kind of rock me. But I suppose it's about being honest about that, being realistic about what you can achieve and you can't. I think within the context of the work that I've done with the choir, one of the biggest challenges for me is you can put in hours and hours of work, and in this context for me, this is outside my job, this is on a voluntary basis, and then somebody goes and just kind of does exactly what you've been working with them to try and stop happening or whatever, and those are the real challenges for me. Like, I could cope with somebody shouting at me and being upset and devastated because I could understand that, but I really struggled with I thought I've worked really hard and I thought I'd really got somewhere, and you move back. But I think it's about remembering that sometimes you just move back and then it moves forward again, and you have to just be okay with it and know that you're still aiming for the same endpoint, is to well-being. But within the students as well, it's something I feel really strongly about. We're just talking about it today with our director of social work about importance of like learning basic skills like how you breathe properly and how you look after yourself. And there's a kind of culture of, oh, it's fine, let's just eat cakes in the and all of this, and we're all going home to drink wine, and don't get me wrong, I definitely was doing that, but maybe we need to think a bit more about well-being and about really making sure that in order to help other people, we've got to be as well as we can be ourselves. So yeah, I think that that's important too.